Hello everybody. Today we are going to discuss another very important topic which can lead to a life-threatening emergency in critical care. So what is the etiology of upper GI bleed? Now we know the symptomatology of upper GI bleed and their presentation. How do we risk stratify them and how do we prognosticate them? So etiology. Etiology can be broadly divided into a variceal bleed or a non-variceal bleed. Variceal bleed, as all of you will be knowing, is secondary to either esophageal varices, gastric or fundic varices, or secondary to a cirrhosis with portal hypertension. Non-variceal bleeding is usually secondary to peptic ulcer disease or a Mallory V stare, angiodysplasias, Dialfoy's lesions, erosive gastritis, some myotoenteric fistulas or infections like fungal infection, herpes infection, CMV infections, tuberculosis, syphilis, etc. So, let us deal everything in detail. For a non-variceal bleed, peptic ulcer contributes to the most common cause. Peptic ulcer or gastroduodenal ulcer is nothing but a breach in a gastric or a duodenal mucosa, and that is most commonly caused due to Helicobacter pylori or chronic NSAID abuse. In patients who are admitted in ICU or in patients with burns, with severe stress, chronic ICU admission, or in multiple vasopressor support, on mechanical ventilator support, they might contribute to a small population of stress ulcers or curling ulcers.